Dyslexia by Sherry Green. Can you tell which child has a disability? What is dyslexia? Dyslexia is a specific learning disability that you cannot see. It does not have any effects on the physical appearance. It affects the processing of language. Children who have dyslexia usually have average intelligence, but still struggle in reading, writing, spelling, handwriting in their native language, and sometimes in arithmetic. There are varying degrees of dyslexia. It varies from mild, moderate, severe to profound. Dyslexia affects 1 out of 5 people. Also, about half the children who have dyslexia also have ADD, or attention deficit disorder. What are the warning signs? According to the Bright Solutions for Dyslexia, there are some warning signs of dyslexia. In preschool, there can be signs of delayed speech, mixing up the sounds of syllables in long words, chronic ear infections, stuttering, constant confusion of left versus right, late establishing a dominant hand, difficulty learning to tie shoes, trouble memorizing their address, phone number, or alphabet, can't create words that rhyme, or a close relative with dyslexia. Some warning signs in elementary school include dysgraphia, slow, non-automatic handwriting that is difficult to read, letter or number reversals continuing past the end of first grade, extreme difficulty learning cursive, slow, choppy, inaccurate reading may include guesses based on shape or context, skips or misreads, prepositions at, to, of, ignores suffixes, can't sound out unknown words. They also may have terrible spelling, often can't remember sight words, there, were, does, or Hahnemann's, there, or there. Difficulty telling time with a clock with hands. In math, they can have trouble memorizing multiplication tables, memorizing a sequence of steps, or with directionality. Also in elementary school, other warning signs include when speaking, difficulty finding the correct words. They may have lots of whatchamacallits and thingies. Common sayings may come out slightly twisted. They may have extremely messy bedrooms, backpacks, and desks. They also may dread going to school. They may complain of stomach aches or headaches and have nightmares about school. Diagnosis. If a child has 3 or more warning signs, they may have dyslexia. If a child has a family history of dyslexia, they may have a greater chance of having dyslexia themselves. If you ask a parent if there's a family history of dyslexia, they may say no. A parent may have a mild form of dyslexia that was not diagnosed. They may say that they have experienced some of the same symptoms on the list, though. Researchers have found 3 genes that are related to dyslexia. They have also discovered that dyslexics have a larger right brain hemisphere, neurons are wired differently, and that dyslexics use a different part of the brain for reading than people who do not have dyslexia. If a child has symptoms, they should see their healthcare provider. Children can be professionally diagnosed as early as 5.5 years old. There is no single test for dyslexia. A healthcare provider will perform a complete medical exam, including a neurological exam, ask questions about a person's development, social, and school performance, ask if anyone else in the family has dyslexia, and also may do more psychoeducational testing and psychological assessments. How to teach a dyslexic child. A multisensory approach is the best way to teach a child with dyslexia. When a child is able to use their visual, auditory, tactile, and kinesthetic senses, they are able to store and retrieve information better. Dyslexic students need intense instruction with enough time to practice. One concept or rule should be introduced at a time. Previous concepts or rules should be integrated into current lessons to help children build on the information taught. Synthetic and analytic phonics should be taught. Synthetic phonics is when individual letters or sounds are combined to form a word. Analytic phonics is when you take a long word and break it down into smaller pieces. Teachers need to constantly assess their children's understanding of the concepts or rules and how they're applying them. As an educator, it is important to recognize the signs and realize that 1 in 5 children in your class may have dyslexia. They may need a different teaching approach. Early diagnosis and early intervention is important so that children will have success in school and life.